Balik sa GMA Regional TV Live mga kapuso, ang DOST, Department of Science and Technology, dunay na-develop ni siya nga application alang niining pag-monitor, pagsubay gyud sa gidaghanon sa mga kaso sa COVID-19 sa usa ka lokalidad. Magamit sab kuno kini labi na sa mga decision making unya sa mga otoridad kung mahitungod na kini sa quarantine status sa usa ka lugar. Subay niini mga kapuso, makauban nato ang OIC Provincial Director sa DOST Cebu, Mr. Brian Ibanez. Good morning, Director Ibanez.
Good morning, Nico, and good morning to all the televiewers of GMA Cebu.
Thank you so much for joining us today, sir. Can you tell us more about this application, this app nga na-develop pag-monitor nato sa mga COVID cases sa usa ka lugar?
Sa DOST we have a web app developed funded by the Department of Science and Technology, which is intended to perform case projections or modeling on COVID-19 cases. If there a chance the COVID-19 cases will increase in the coming days, or will it decrease? One of its features. So the title of this app is Faster. So Faster, but this acronym contains 3-letter S, no? So FASSSTER, and it stands for Feasibility Analysis of Syndromic Surveillance using Spatio-Temporal Epidemiological Modeler for early detection of diseases. This app is not very new. This has already been operated and used around since 2016. On other diseases, before pa nag-COVID. This was initially used to model or predict the surge of what we call as sa unang cases for measles and other mga diseases. It helps as one of the decision criteria to decide whether to support or to approve mga community quarantine levels.
Subot pasabot sir kung either mo downgrade or mo upgrade, makita nimo ang projection kung sakasakali kung pila nay pagsaka o pag-ubos po sa kaso, depende sa unsa niya decision sa quarantine status.
Yes, Sir Nico. Yes, that's true. That is its main purpose. So we need magud scientific data to help, in addition to the existing capabilities of our PNP to secure the area, and to help really the people perform these different health standards.
Sir Brian, how about ang concentration sa cases sa usa ka locality, for example, sa usa ka sitio or barangay, ma-determine po nato pinaagi ani nga app?
Now we have the app has been improved nga ma-cover na ni ang barangay level, not just municipality, barangay level, so you can see if there is a what we call as clustering. Bantay bata na mag-clustering ang cases kasi sikit different nga mga areas, mga balay, in the mapping. So you can see that, and the significance of that particular feature of Faster is it can again assist the municipality if which barangay are we going to implement a fragmented lockdown.
Karong panahon na Director Ibanez murag gamit kay technology, do na say kaning pananglit we trace application sa province, gikinahanglan gyud ron bisan og this is a health issue we are facing apan of course agulan sa nato og teknolohiya pod.
Number one gid na purpose sa technology is to make things easier and faster to kanang to facilitate ba nga kanang dili na ta may use og manual nga mga data retrieval. Faster is not a closed program. This particular app, it can be linked to any private or government nga mga data and epidemiological data.
Apart from this, Sir Ibanez, unsa pa ubang mga gipangbuhat ninyo sa DOST? We learn nga murag nag-produce kuno pud mo kining mga collection booth,
swab collection booths or SCB, swab collection booths. And then this was already deployed to the hospitals, government hospitals. The SCB, ang purpose niya is to facilitate the collection of the swabbing. The booth is nice kini siya nga booth kay kuan ni siya it contains a ma-protected ang atuang health worker, no, kaya itong frontliners ba kay kuya magagay sila ma-contaminate, no, or ma-infected. These booths are ready na ni siya when we deploy it, ready na ni siya to use because it is nice kay siya because it's air conditioned. Air conditioned na ni siya, and it has a what we call as kanang pressurized ni siya in order to minimize the entry of the environmental contaminants, no.
Unsa man ni nga site sir nga pwede ma-visit sa public?
And the website niya is https faster.ehealth.ph.
Finally, yes. Sir Brian, sila imong gusto ipaambit sa atong mga message mo sa atong mga viewers, gikan pud ninyo sa DOST kaliwa gihapon ni atong sinati karon sa gubang karon nga pandemya, sir.
Yes, Sir Nico, no. Okay, I'd like to invite everyone to avail, no, and visit the DOST natong website. We have a lot of programs and projects that related that is helping our current COVID-19 health crisis.
Sir, magpasalamat mig dako sa kahigayunan sa oras nga gihatag nimo kanamo karong buntagang OIC Provincial Director sa DOST Cebu, Brian Ibanez. Salamat kay sir.
Salamat po kayo, Sir Nico and GMA Cebu. Good morning, tanan.
Thank you, sir. Good morning.